Hicks, your host, and today's guest is Dr. Heather Pearman, who is a holistic chiropractic practitioner. Her practice is in Pelham, New York, and she has some very, very interesting things to tell you today. So Dr. Pearman, welcome to Impact. We're so glad that you decided to spend the day with us. Would you tell us a little about yourself and your practice?
Well, first, I just want to say thank you for having me as a guest. I feel extremely blessed and grateful to be here. As you said, I'm a holistic chiropractic practitioner, which means that it's how I look at my practice. I really look at it from a mind, body, spirit perspective, and I utilize different techniques in my practice to evaluate what patients' issues are from a purely holistic perspective.
Okay, and then you treat them accordingly?
Yes.
Okay. When did you decide to, first of all, what is your training? Okay. And when did you decide to go into holistic chiropractic?
I attended Life University in Marietta, Georgia. Mm-hmm. That's a chiropractic institution, and that's where I went to chiropractic school. And after I graduated and I got into practice, I started to look into as part of my graduate education, looking more into nutrition and into other techniques that would enhance my patients' progress, and that led me into a more of a holistic mindset after I graduated.
That's interesting. So were you always mindful of proper nutrition?
No.
Okay.
Definitely not.
Only when you began to work as a chiropractor?
Absolutely.
And
Absolutely.
what influenced you to look at the nutrition aspect of it?
There was a technique that I learned called applied kinesiology, and that involves both a structural analysis and a nutritional. So that's where my first real introduction to nutrition was, and realizing that patients were actually progressing significantly better once we incorporated the nutrition into the adjustment, along with the adjustment.
And did you design a nutrition program yourself or with someone you work with?
Well, it just depended on what the patient's needs are. Today I do what you call designed clinical nutrition, which is about creating a program that's designed to the patient's needs. It's not cookie cutter, it's not 1, 2, 3. Really? It's about trying to identify what the issues are and what supplementation in order to utilize to enhance their progress.
So the program is specific to each individual you treat.
Yes.
That sounds great. Another question that I had is, what is neuromodulation technique?
That is an energetic technique, by far my favorite. It's about accessing your internal control system, what we refer to as the autonomic control system. And when illness steps in, this can throw your internal control system off. And through the modulation technique, we are able to evaluate through what we call muscle testing, kinesiology, to see what is throwing your system off. So it allows us to look at an array of different things, whether it is a nutritional factor, whether it's an emotional component, whether it's a structural component, whether it's an immunological component. And the neuromodulation really allows us to pull this information and reset your system. It's almost a reprogramming of the body.
Okay,
of the
so
mind-body.
I walk into your office and I'm a first-time patient. How do you find out what my needs would be? Do you talk to me, or do you do specific testing, or do you do both?
Both, absolutely. We definitely have to take a history on you because we have to know what's happening with you.
Exactly.
Okay? So if you're coming in with any sort of health issue, we definitely have to look at that. Then we take it a few steps further by doing the analysis, utilizing nutrition response testing. That's where the nutrition comes in, or the design clinical nutrition. Also with the neuromodulation, that's really going to help us to see what else is involved. if there's an emotional component, which is major, because on a cellular level, that's something that can actually dysregulate your immune system or your structural system and not allow your body to function the way that it should be.
Wow.
Yeah.
What about the psychosomatic energetics?
That's that is an emotional piece where emotional conflicts can definitely can play a role in health issues. So that allows us to definitely to zone in on specific emotions that could be throwing your systems off. Okay, so we're able to identify what emotions could be playing a role. Also with the neuromodulation, but the psychosomatics is a bit more, it's a different type of analysis, so we use several things to see what's playing a role in why that patient's internal control system is off.
Okay. And have you had a 90% success rate with your patients?
With all patients?
Yes, with your patients.
With a 90% success rate? Well, it varies. It could be 100% and it could be 75%. Okay. And then there could be situations where you may not just be the practitioner, you may need to refer them out if this is more of a medically oriented case, but we do have a high success rate with patients.
Very good. So
yes.
Your patients leave you feeling extremely well and looking as good as you do? And
well, you know, I've been, it's recently been expressed by one of my patients that I'm her private embalmer, so to speak. You know, and I said, because the joke was that, you know, I'm here to preserve you. And, you know, just by keeping you on your nutrition program and keeping you structurally sound and also trying to keep you consciously sound as well and emotionally sound.
Sometimes we get the feeling in this country, well, I do, that the medical doctors are not necessarily on a in the mind frame that they want to get you well and get you completely well in all aspects. So
it's just a different mindset altogether. You know, the training is different, the mindset is different. You know, we as holistic practitioners look at the whole. Okay, that's why my practice is called Holistically Yours, Health and Wellness, because it's really looking at the whole person. It's not just about looking at things from a symptomatic perspective. It's really looking at everything that is playing a role in why your body isn't functioning.
And I really appreciate your spelling of the word holistic. One would think, hearing it, that it's H-O-L-I-S-T-I-C,
yes.
but you're saying the whole.
Exactly.
So it's the whole body. You're holistically yours, health and wellness. I like that very much.
Thank you.
Is this something that parents should let their children be involved with?
Oh, absolutely. You know, especially with my children, they're involved.
Yeah.
Okay. My children, you know, since birth, okay, they've been on the holistic route with how they eat, the supplementation that they take, you know, just always want to keep their brain active, want to keep their immune system strong, want to keep them structurally sound. So, you know, that's the path that I take with my kids. So that's exactly what we would love to do. I mean, that's what we do with other children as well. And we treat everything from infants to...
We're going to take a quick break right now. And when we return, Dr. Pearman is going to enlighten us and the viewers and demonstrate how this is done. We will be right back. How was that, Dr. Pearman? Was that okay?
Yes.
Welcome back to Impact. We still have Dr. Heather Pearman with us in our studio, and she's been enlightening our viewers about holistic health and wellness. Dr. Pearman, when we were talking before we began the program, you mentioned something about geopathic stress, which I thought was very interesting. Would you please elaborate on that?
Sure. Geopathic stress, which I was first introduced to, I guess you could say the concept of it about 2 years ago through one of the techniques that I utilize in my practice. I learned that it's about a stress, an energy stress that comes from the earth, excuse me, that has to do with fault lines and water lines and how this actually emits an energy that we can't feel. And in countries like Germany, practitioners, even medical doctors, look at it as a cofactor, something that could actually be playing a role in why someone has developed cancer. So recently I had a guest in my office. We did a workshop on Are You Sleeping in a Safe Place, talking about electrosmog from computers, cell phones. Here, all these things actually do impact our health today, and geopathic stress. And it was really an amazing workshop. The driving force was because I had a patient where his lab values on his blood test didn't make any sense. And then we evaluated him and definitely confirmed. So by having the guests come in, it was just to inform the patients about what exists. So the guest that was in my office, she's a dowser. Dowsers are utilized all over the world to evaluate different things, but one thing is energy imbalances in a household. So I had this dowser come into my house to evaluate my home, and just out of curiosity to see how it works. And she actually found a zone, and it was just really a blessing. It was the biggest blessing. I invited her to come in and communicate with the patients and explain to them what geopathic stress is. But you know, she was actually there for me as well, because prior to that, you know, when the weather broke, I have some sensitivities to mold, and it definitely affected my health. I started coughing, and I was sleeping in the living room because I didn't want to wake up my family. And but I just found that at night I could not sleep. I couldn't kick this thing. My breathing was off. It just did not make any sense. I would get worked on by other practitioners. I'm on a nutrition program. Nothing seems to be working. So when the dowser came in and evaluated the space, she actually found a geopathic stress zone. All that I did was move to the other side of the couch. I'm now sleeping like a baby. I'm sleeping in bed again, but I was not able to sleep, literally up night after night after night. And it was just unbelievable. And you know, I actually see it as a gift that I was experiencing all of that, because I can actually testify to the fact that this, even though it's not an energy that you can feel, it's very real. And there's a doctor in Germany, I'm sorry, I apologize for not being able to, in England, not being able to think of his name right now, that he was one of the practitioners that brought it to the forefront, because his son had developed cancer, and he knew that there was something in his house that was playing a role in that. And a medical doctor who was teaching a course on the work, I actually took his workshop, and he said that he's never had a case where, with regard to cancer, that a patient wasn't being affected by that. But we're seeing it in so many things when patients can't heal, if they're not sleeping at night. It's not just relative, quote unquote, to cancer, but this actually could be a cofactor, and it's amazing. It is absolutely amazing. So, you know, there's more to what we know about, okay? And these are things that are not in the public eye, but they should be. And, you know, for the work that we do as holistic practitioners, this is the information that we need to bring to the forefront and look at to see if these things are playing a role in why your body isn't functioning.
I have two questions. I think some of the other cultures have been aware of this geopathic situation. Feng Shui.
Absolutely. Absolutely.
And we knew about that years ago.
Absolutely.
Okay.
Absolutely.
Now I wanted to ask you, are there many other holistic practitioners in this country?
Oh, absolutely. Tons.
Oh, okay. Do they
Tons.
know about this geopathic stress?
No. No.
Wow.
No, they don't.
That's really amazing.
Because my awareness only, I would say, within the last 2 years. I had no clue, and I've been a holistic practitioner for over 10 years. So this was really a first for me. But to learn about it and then to be affected by it. Yeah, and it's a line that's running through my entire apartment. Yeah, so your bed, if your bed is over it, you know, it's just understanding that, again, it's an energy that, you know, this has to do with Mother Earth. It's not,
Yes.
some of it could be man-made, but there are also factors where, again, it's just, this has to do with Mother Earth. So, you know, dowsers could be utilized if you're purchasing property. You know, you
Right.
want to see where, if this exists. Or just, in my personal opinion, from my experience, everyone needs to have their house evaluated. Absolutely.
While you were telling us about it, I was thinking of that myself. You know, how many of us live over this fault, if that's what you call it?
Yeah, water lines, you know, it's just amazing. I mean, there's more to it than that. I mean, if you do the research on quote unquote geopathic stress, but it's just the fact that it's a stress that does exist. Yes.
Well, thank you for that. 2 more questions. Point-based techniques and vial-based techniques.
Point-based techniques are where you are, when you're analyzing a patient, that you are contacting different points of the body, okay, to see where there's an imbalance in the system. And then the vial portion, which actually coincides with the point-based, is where you're utilizing vials in order to see what's affecting the patient.
When you say vials, what do you mean?
Vials, just like little vials that fill with with water, and they actually have the same frequency of the stressor that you're testing. You know, we could be looking at heavy metals, food sensitivities, immune challenges. Yeah.
There is so much to this, more
Yeah.
than somebody like me could imagine.
Yes.
So, you know, glad that you're interested enough in it to try to research it. So, what responses can be produced with your work?
Wow, it's endless. You know, we see, you know, patients come to us for all different things, you know, whether it's weight loss, fertility issues, back pain, headaches, skin issues. We have children that come to see us, digestive issues. I mean, the list goes on. And being able to utilize all of these techniques, it really gives us a nice broad scope as to what's happening with the patient. We also look at blood work, and we do saliva hormone testing to see where, in addition to what we find with the other testing, what other factors are playing a role.
Have you been successful in your fertility issues?
Yes.
Very nice.
Yes.
Okay.
Yes. A lot of detox. A lot of detox, getting the body together. You know, you have to treat your body like it's a temple.
Exactly.
And you really have to understand that piece. And that's a mindset, and that's what we work with as well. You know, trying to help you to eliminate your fears and trying to move forward, as opposed to feeling that you have to be stuck into eating a certain way. Okay, it's not about denying you of certain things. It's about you, with the nutrition work that we do. It's about you understanding what works for your body. In our practice, you can see what's working for you and what isn't, just through the elimination process and reintroducing these foods. You can see for yourself. You don't necessarily have to go out and spend hundreds of dollars on a test to see if that works for you.
Right.
Yeah.
For somebody else to tell you. You told me when we were talking before that you started your daughters in this holistic approach when they were born.
Yes.
That's wonderful.
Yes.
And I think the bad behaviors that we get into, they're learned behaviors.
Yes.
So a good behavior, why shouldn't that be a learned behavior too?
Absolutely.
Yeah.
Absolutely.
Okay. Now I have another question to ask you. I already know the answer. Is every member of your family involved with the holistic approach?
No. As much as I would like for them to be, no.
Well, I think that's the way it is probably in most families.
Yeah.
I would like you to tell our viewers about your workshops and the main issues your clinic addresses.
Wow, we address an array. We look at all types of issues. We do a lot of brain work. We also talk about immune challenges, structural issues. We also look at the emotional issues. We have workshops on that as well. Also inviting guest speakers in that are other holistic type practitioners, like with regard to the dowser that was just in my office. Even we try to even incorporate with regard to skin and hair care, trying to get away from a lot of the products that are on the market today that are just so polluted that I actually found a hair care line being at an eco festival 2 years ago. So I've gotten away from chemically processing my hair, which I did for years, but I really just wanted to get away from that, and that's a company called Bella Genza. And we have actually the owner come out a few times a year to speak to my patients because he's going to know more about hair than I do, and the questions just, they're endless.
Yeah.
So,
You're a good advertisement for him. Your hair is absolutely beautiful.
Thank you. He'll appreciate that, and I appreciate him because he's not just, it's not just about the products, it's also his mindset, and I think that's one of the main reasons that we actually click, because it's not just about a product. It's not just a product for him. It's about, he puts his heart and soul into his work, and it's the same thing with myself.
Okay. Would someone coming to you for your holistic technique, could we expect to look half as good as you do? And I'm not patting you on the back again, but you just look so fresh, so healthy. Could we expect to achieve the same thing?
If you are, I mean, I had a patient today that, as I was saying earlier, that she jokingly said that I'm her private embalmer. You know, aesthetics are important to a person, and you know, before I even got into the world of holistic healthcare, I worked retail for years. So I know what it is to want to look good and feel good, but when you look good, you also want to feel good. When you don't feel good, you can't always look good because you don't feel well.
Right.
So it's really, it really has to be about you feeling healthy, and when you're healthy, you definitely look more vibrant.
I love that. Would you just repeat that line, what you just said?
When you feel healthy, you definitely look more vibrant. It shows, it just shines through.
I love that. Well, we're going to Dr. Pearlman's office where she's going to demonstrate how some of these techniques.
Okay, so what we're going to do right now is I just want to give you an example of the testing that we do, so this way you can see how we respond to certain things. Everything has a frequency, it has an energy, and the body responds to energy, and it responds to what's good for us, and it responds to what isn't good for us. Okay, so this is just to give you a little example of of some of the analysis that we do. This is called kinesiology, which means muscle testing, and once again, we use it as a form of analysis. Okay, one form that we do. All right, so what I'm going to do is, Adele, I'm just going to apply some pressure to your arm, and I just want you to match my pressure. See how your arm is just locking?
Yes.
Okay. And it's not a me versus you test, okay, because even as I apply force right now, your body is responding, okay, to the test, and it's locking, okay? And even if I use more force, just keep your arm straight for me, it's locking, okay? And that's basically like an innate intelligence right now that's responding, okay? So as what we utilize as a form of calibration is I'm going to place my finger on the bridge of your nose, okay? And just keep your arm straight here for me. Okay, and this is just letting me know if I can actually test you, if you're testable. So when I place my hand here, see how your arm, see how it locks?
Yes.
And then as soon as I turn my finger over, see how that releases? Okay, and I don't want you to anticipate it, just match my pressure.
So I'm not going to look, okay.
Okay, match my pressure, good. Here, it's the lock, then it released. Okay, that time you were totally just not mentally involved in the testing, okay? So here, once again, you see how your arm locks? Okay. So now I'm just going to take something, this is white sugar. White sugar has a very low vibration. It invites any infectious agents in, bacteria, viral. It basically rolls out the red carpet for them, and it totally weakens your immune system, okay? It has not an ounce of anything nutritious in it whatsoever. It may taste good, but it's actually destroying us when we eat it, okay? All right, so here, match my pressure. Okay, good. Match my pressure here. Okay, so you see how your arm is locking?
Yes.
Okay, as soon as I put that on you, again, don't anticipate, I just want you to match my pressure. Okay, good. See how that's releasing? Okay, good. Right there. You just have no strength.
Yes. Oh
okay.
My gosh.
So that's sugar. Match my pressure. equal. Okay, artificial sweetener. Okay, so now this is just a glass of water. Remember, everything has a frequency. Okay, here, match my pressure. Match my pressure. Match my pressure. Good. I cannot push your arm past this point. Okay, see how it's locking? Match my pressure. Beautiful. Okay, your body responds well to this. Versus, match my pressure. No strength. No strength. No strength.
That is weird.
That's what we generally get the first time around. But again, everything has an energy, okay? You know, even there's a doctor, his name is Dr. Emoto. He did tests with water, okay? And he shows you how even when you're experiencing what they call catabolic emotions, emotions that could break us down, you know, water responds to that, okay? And being that we're made up of 98% water, okay, our body responds to even emotions. So I want you to match my pressure again. Keep your arms straight here for me, match my pressure. And I want you to say, empowered.
Empowered.
Okay, now I want you to say, powerless.
Powerless. Ooh.
Just like that. Do you see the difference?
Yes.
Okay, let's do that again. I want you to say, anxiety.
Anxiety. Ooh.
And now courage.
Courage.
Totally different.
That is so weird.
Yeah. So again, the body can respond to emotions, foods, environmentals, the list goes on. And that's just a brief analysis, okay? You know, at first it seems very awkward and weird if you've never been exposed to that, but that's one of the things that we utilize to, in our analysis, to see what's going on with you, along with incorporating other things, like I said when we were talking. Yeah.
Well,
and it's amazing what that comes up with.
My goodness, thank you so much for that, Dr. Pearman. We really appreciated it. I don't know what to say. We want to give Dr. Pearman special thanks for being here with us today and imparting your knowledge to our viewers about your holistic way of chiropractic. Also, viewers, if you want to learn more about Dr. Pearman's Holistically Yours Health and Wellness, please refer to our website on the bottom of your screen. We thank you so much for being a part of our Impact audience today. We thank you. Remember that knowledge is power, and power has impact.